Hi everyone, let's consider atropine for a moment. First, its mechanism of action. How does atropine work? Atropine is an anticholinergic or a parasympathetic blocker. Now, to understand that, first we got to go back. We have to kind of take a look at the sympathetic and the parasympathetic nervous system and review how those work. Now, the sympathetic nervous system is your fight or flight. The sympathetic speeds everything up, right? And I'm going to use an example of an automobile to illustrate this. So the sympathetic nervous system would be the gas pedal in a car. The parasympathetic nervous system kind of slows everything down. It's rest and digestive. The parasympathetic nervous system in the car would be the brake pedal, right? Gas pedal, sympathetic, brake pedal, parasympathetic. Now, inside the body, both systems are working simultaneously, which means in our car, we're driving with both the gas pedal and the brake pedal depressed at the same time. That's how human beings work. So we're driving around with the gas and the brake applied at the same time. Now, let's say I want to speed up the car. I want to get the car to go a little faster. Maybe increase my heart rate. Have a couple of options. One, I could just press harder on the gas pedal. In ACLS, that would be administering a sympathomimetic drug, something that's going to stimulate the sympathetic nervous system. Epinephrine, a great example. Epinephrine directly stimulates the sympathetic nervous system, or we're pushing down on the gas pedal. Another option, since I have the gas and the brake applied at the same time, I could just take my foot off the brake a little bit. And that's what atropine does. Atropine is a parasympathetic blocker. So by blocking the parasympathetic system, taking my foot off the brake, I'm allowing the sympathetic system to rise to dominance, and it is actually the sympathetic nervous system that is increasing the heart rate. That's how atropine works. Now, the areas of the heart that atropine will impact, the SA node and the AV node. It increases output from the SA node, increases firing. It also increases conduction through the AV node. Next, indications. Why are we giving atropine? Well, atropine is the first-line drug for symptomatic sinus bradycardia. Another use for atropine cited in the literature is for organophosphate poisonings. However, you're going to have to give quite a bit of atropine to reverse the effects of this toxin, usually 4 to 6 milligrams. I've never had to treat an organophosphate poisoning with atropine, thankfully. And in that circumstance, remember, your safety comes first. But you can use atropine to treat organophosphate poisonings. So the dosing for atropine, you're going to administer 1 milligram every 3 to 5 minutes to a total dose of 3 milligrams or 0.04 milligrams per kilogram of body weight. Now, some special considerations. If you're using atropine to raise the heart rate and atropine isn't working, be prepared to transcutaneously pace this patient. So have your pacer ready. Another thing we need to think about is, why is this patient bradycardic that we're giving the atropine for? Might be in the presence of an MI. Here's why. In most people, the SA node receives its blood and oxygen supply from the right coronary artery. The right coronary artery also supplies the inferior wall of the heart. So it is not uncommon to have bradycardia associated with an inferior wall MI. So this has been a quick review of atropine. Thanks for watching. I'm Mark. We'll see you in the next video.